A very good evening to you, esteemed viewer. It's a pleasure having you watching Church of Uganda Family TV. This is HEALTHPOT on Church of Uganda Family TV, brought to you by Mukalazi University School of Public Health, together with Church of Uganda Family TV. And of course, this program is centered around maternal and child health, early childhood development, and other public health concerns like the one we are talking about today. Of course, we know that very many times we get a lot of issues at our places of work, probably by the way, because of the way we see it or the way we spend our days at the places of work. That is why today we are here to talk about the occupational safety and health. Very, very important that you pay attention to this discussion, because it is going to change the way you look at things. Even those that you think are minor might be major in future if you do not react on them. I just remind you that we are with students of environmental health under their association of Mukalazi University Environmental Health Students Association. With us is Edrine and Nichodemus. They're going to say hi to us, and then we shall get into the discussion. Now that it is ladies first, we shall start with Edrine. Edrine, a good evening to you.
Good evening to you all, our dear viewers. My name is Nakuya Evelyne, a third-year student of Bachelor's of Environmental Health Science at Mukalazi University School of Public Health. I also happen to serve as the Finance Secretary for Mukalazi University Environmental Health Students Association. I take this pleasure to welcome you, our dear viewers, to this show. Thank you so much.
Now that we are seated next to the Finance Secretary, after here we shall sign on. Maybe. Okay, maybe. And Nichodemus, you're most welcome to this show.
Well, thank you, and good evening, our esteemed viewers out there. My name is Nichodemus Agumenawe. I'm a member of MWESA, that is Mukalazi University Environmental Health Science Students Association, and I'm in the first year, and I work with Nakuya Uganda Limited. It's purely a safety and health consultants and training company.
Okay.
Yes, as a technical director and the founder.
Wow. So we are dealing with founders, finance secretaries. So, wow. I know my pockets are. Well, we are dealing with occupational safety and health. Nichodemus, if you can give us a brief interpretation of this phrase, occupational safety and health. What is it all about? What does it even mean now that you run a consultancy firm?
Okay, thank you so much once again to our esteemed viewers out there. It is as simple as occupation. What you do to earn a living, put money to put food on the table. That occupation, that activity, that task that brings food and money to the table. Then our interest is how safe are the tasks vis-a-vis the worker, and how healthy are they? Are you going to earn that living and lose your life in the next second, the next minute, the next 1 week, the next 1 year? So our interest here is, much as you earn that bread for your family, for yourself, we want you to earn it safely in a very healthy and safe workplace. So all the measures put in place is to ensure this human being, this most valuable asset on earth, he should be, safe and healthy.
Okay.
Yes, as simple as that.
Okay. So I now realize that it's even more important that you pay attention because people will say, I mind about how I sleep, but now I think it is equally important to mind how safe the environment is where you're working from before you think about sleeping. Some people even sleep at work. Edrine, why is it important that someone really, why is it important to promote this safety and health of the to pay attention to occupational safety and health?
First of all, I would begin by saying that when we promote OSH standards, you're going to increase...
You know, when you talk about OSH standards, someone out there might know what is OSH.
Okay. So I would say when you're promoting occupational safety and health standards, you're putting in place measures to ensure that your workers are in a safe and healthy environment. So in the long run, you're going to increase their well-being. And as you're increasing their well-being, you're going to increase productivity. Just imagine you're coming in a workplace and everything is just safe for you. You're able to interact with your colleagues very well. No one is psychologically torturing you. So there is a way you're going to feel comfortable working in this environment. And at the end of the day, your productivity is going to increase. Then also, when we are promoting occupational safety and health standards, you're going to reduce financial costs to this company, because as we're looking at this occupational safety and health, first of all, it is the main responsibility of the employers. You who is bringing in place these employees, you have to ensure that their environment is safe. So as you're promoting that safety, as you're promoting that health of the workers, in the long run, like I had talked about productivity, so also the financial, you're going to reduce on financial costs on things that may not be valuable to your company. Just imagine you're compensating people day in, day out. You're spending money on insurance premium all the time because of the workers, since you didn't create a safe environment for them. So in the long run, if we are promoting these occupational safety and health standards, you're going to reduce financial costs as a company or as employers on things that are not valuable.
Okay.
Yes.
Thank you so much, Edrine. Nicodemus, we look at, like she said, now we've looked at why it is important to have to also pay attention to occupational safety and health. But someone would really ask themselves, what are some of the dangers that unintentional dangers that can come by if we do not do all these things besides spending money and what? Now we look at the life of the employee whose health has not been, whose safety at work has not been really maintained. What are some of the dangers that a human being is should or will be seeing or will be getting in turn?
Okay, thank you so much. Allow me to supplement one point of
Okay, it's okay. It's okay.
It is also important for us to understand that safety, occupational safety and health, has about 3 basic reasons why we need to implement it. There's a legal consequence if we become non-compliant.
Okay.
And we draw all our energy and our mandate for the safety and health practitioners from the Occupational Safety and Health Act, number 9 of 2006. It was it came into place just a year before CHOGM, and it was one of the requirements to host CHOGM, to ensure that actually a lot of activities leading towards that CHOGM day were done, in line with the Safety and Health Act. It's also societal. It is a societal responsibility. The society can't really sit back and relax and record so many road accidents, so many people dying at workplace, so many bodied men and women being injured due to poor ergonomics, heavy handling or manual handling. The society will raise up, and they will raise up through their own groups, through local councils. It becomes an issue. It could be a women issue, it could be a children issue. And once the voices of these communities stand up, they can even put a project of national importance at stake, at hold. So besides the money bit, there is that societal responsibility, the moral obligation. We do not send, our parents do not send us to school, to workplaces, to be injured, to contract diseases that could really have a long-term impact on our health. You get, so there's a moral responsibility for you and I to comply with for our employers to comply with. You know, issues to do with like wholesome drinking water, for example. It's mandated, you know, that employers have to provide safe drinking water to workplace, honestly. You know, safe is what we call welfare services. You know, access to basic needs like toilets. What's the condition of these toilets? And I usually visit most of our toilets. They do not have what they call shataf, or it's called bidet. You know, just like the shower, you shower on your head. After using the toilet, you must shower, you know, your private parts for the safety and health of your body. And when you do not do that, I want to have a direct interpretation of how much the company pays and, you know, UTIs. Is there any correlation between the health of our toilets or the hygiene of our toilets and how much money we are spending treating, you know, UTIs? You get. So is there any relationship? Is there data that can relate the behavior or the unsafe workplaces to insurance claims? You understand? So when you say the dangers, one, I want to appreciate that most of us, when you look at the workforce, we are not aware that actually we have a right to a safe and healthy workplace.
Yes.
We're not aware. So maybe MWESA and other entities, in particular School of Public Health, we need to raise awareness and say, hey, this is your right to a safe and healthy workplace. And it is our responsibility as employees to report any dangerous occurrences or hazards at work that we believe they put our lives at risk. It is our responsibility according to the Occupational Safety and Health Act. So are we given that right to communicate, to pass on those hazards? We see, I could say I'm carrying a bag of cement, but my supervisor, my back is paining. So are you going to listen to me? Or it is, we have so many casual workers, if you can't lift anymore, but have a right to work safely. And look at the impact of such a manual handler. I'll give you an example here. Heavy lifters rarely fall sick.
Yeah.
Rarely. They will tell you, we had this gentleman in the morning, he just passed on in sleep. Yeah, because the forces exerted on the vertebral disc due to heavy lifts, if you're not trained, if you're not aware of the dangers of the lifting posture of that weight on a daily basis, could have an impact on the vertebral disc. And the moment they wear out, or they are damaged gradually, because trust me, how often do you go for medical checkup when you're healthy? Often.
That is not
even when you are healthy, you want to do self-prescription. You have to go do an over-the-counter, you know, prescription. We really don't have that culture to do general checkups. You know, every January to set your goal 2024. My health status is tick. Diabetes, negative. You know, sugar levels, high blood pressure, cancer. You don't want to know your status so that you set your goals according to your health status. And even at that level, you still have a chance to arrest certain health conditions at an early stage. So the awareness, and also to appreciate my life, your safety, my safety, is very important. So this young boy, the dangers of these, the young folks that are not appreciating and they're not aware of their safety and their rights, is we may have an increase of a certain disease burden after some time. Probably if a generation of 20 to 35 are working unaware and they're exposed to these occupational hazards and environmental hazards, give them a decade or two, you know, by 2050 something, there's going to be a disease burden that we can't easily trace. And that could be a generation at risk. You know, we have talked about the poor air quality in Kampala. Trust me, a few decades from now, there's going to be a high rate of respiratory disorders because there are no interventions. They say plant trees we're not planting trees. We are instead cutting trees. They say we use green energy. We are still going for charcoal. What are we inhaling?
Sure. Yeah, let's take a short commercial break. When we return, we are going to discuss this in details because I realize we even need more time to re-emphasize this particular aspect of occupational safety and health. We are taking a short commercial break. We shall be back. Welcome back from that break. We are looking at occupational safety and health. Very, very important that you know these things we are talking about here, because we are burying ourselves, we are hurting our bodies, and we are creating a very big risk onto ourselves if we do not pay attention to some of these things that look minor in a sense, because not everyone talks about them, yet they are silent killers. These are silent bombs. You'll not see them, but before you know, it has already busted on you. Edrine, we're looking at, like Nicodemus had taken us through some of the examples of these. What do you have to say about what happens in families, especially?
Yeah, maybe in families, first of all, there are many hazards, I should say.
Hazards?
Yes,
Many hazards?
There are many
It's
hazards.
a rough statement. Many
there are
hazards.
many occupational hazards. I could give an example of these sockets, electric sockets. So just imagine this socket, we are having wires just exposed. So there is a high possibility of this socket causing an injury, maybe to a child or even an adult. Usually these children are always playing in and out.
They call them the fastest hands.
Those ones. So just imagine this child gets into contact with this open wire, I should say. So there is a high likelihood of this child getting electrocuted. So this is a hazard. We could look at fire. If you look around Kampala, most of the households, most people cooking inside their houses. So they are using charcoal, probably charcoal I should say, because that is the commonly used mode of solid fuel. So just imagine this charcoal is just there. Maybe the mother is boiling milk or anything, and then these children are just coming to play around this place. So in another way, these children are going to get exposed and they're going to get injuries out of this. And you as a parent, trust me, you're not going to leave this child to suffer. You're obviously going to incur expenses and find out how you can make their lives better. So money that would have been spent on other important things is going to be spent on treating these children, or even you as adults. Yes.
Okay. Yes, Nicodemus.
Well, thank you so much, Evelyne. I happen to be a father of 4. And this in particular role it touches me directly. The role of employer. I employ a maid at home, and I'm supposed to give necessary information, training, and again supervise her work. Okay, through my wife. That is it. I'm telling you, we have had cases of drowning in basins, crawling kids. Crawl onto the basin filled with water. Okay? Then all of a sudden they climb up, they fall into with their head in there. We have had cases. We had a case in the village where I live. They had a bucket of bushera. A young baby crawling about 1 and 8 months. Crawled, got down to the bucket, tried to, climb, how adventurous these kids are. She lost stability and she fell with the head dipped, first in the bucket. She drowned in bushera. Now, at the home setting, with these .com kids who play hide and seek, these kids hide in fridges. They hide under vehicles. These kids are hiding behind gas cylinders, under electric table, stoves, Now, what is your role as a father? Are you offering enough information to the maid? Anyway, do you do a safety orientation to the maid? That in case of this fire, in case of fire at home, this is a fire extinguisher. Anyway, do you have a fire extinguisher at home to start with? Okay, fine. Look at the drowning. Or a child slips and falls, bangs his or her head on the tiles. Is this maid given the basics of first aid? Or we assume first aid is for us in the corporate world. No, that is our workplace. So my role as the father, as the head of the family, is to ensure there is enough information. I've trained the maid. And I supervise. So the issue of drowning at home, take it serious. I know parents out there have big basins for little. Do not leave any filled bucket, basins, mention them, open to crawling babies. Inform the maids about the safety of that. That is something I really wanted to share.
Okay.
Yeah.
What about the schools? Because we've had very many instances in schools. We understand the Ministry of Education has a framework that should be followed by schools, but some proprietors don't pay attention to these things. And basing on the way we operate in our country, it is very easy to get a license. So they get, some schools aren't even licensed. But what should a parent take note of when they take their child to this school? Because at the end of the day, the effect will come back to the parent. They've taken through the maid, and the maid knows what to do, but they're not about at school. What are some of those things that the parent should watch out for as they take their child to school?
There's a common saying that you only see what you know. So that means what you don't know, you can't see it. Now, if you really don't know about safety and health, would you even go on and try to have this keen eye on how the dormitory of the school is set up? Do you see the spacing? Do you see the corridors? Do you see the fire extinguisher? Do you even ever ask? You don't know. So
some schools actually don't allow parents to enter into dormitories to check. I think they have this fear that they'll find out some of these things.
Exactly. So for me, still, yes, at that level, I would wish a parent to be empowered to exactly know the importance of safety and health. If I'm paying 1.2 or 1.5 or 2 million for school fees of my child, I also have the courtesy to understand the safety and health of this school. Exactly. We've personally, because I'm passionate, I came up with kids safety camp, and I trained my kids about school safety, about road safety, about fire safety. So my kids, when they went to school, they asked the matron, why is the fire extinguisher raised so high? In case of fire, I can't carry it. And these are kids in boarding schools. Now, I may not change the hierarchy. I may not impart all this to the head of the school, but I want to change one life. That is my child in school. And if you can have these kid safety camps and you're training them basically fire, next session, first aid, we empower them. We will definitely at one point have the schools comply. We know the enforcement in Uganda is so low, especially in areas of safety and health. Yeah, because they are probably trying their best. Exactly. So for schools, we do not do risk assessments. We're supposed to do like fire risk assessment before the school opens, to know the status, to ascertain the status of these fire, incidents. Then after, we could do pre, mid, and post school. And I wish schools could do that as part of in-house or, an intra program to ensure zero incidents. And I want schools also to come out and start celebrating zero school fires in a single year, zero accidents in a single year, because those are KPIs that indicate, key performance indicators that indicate the population, the people out there are appreciating safety. Instead of celebrating a birthday, at least let this entire school celebrate 365 days with zero, fire cases, with zero road accidents. Let's appreciate from that level. And for me, I tell my family, first week of January is general health checkup. Among the resolutions for the new year, health comes first. Because a healthy workforce is a productive workforce. A safe environment is a productive environment. A safe and healthy, cautious engineer is that safe structure, is that safe plan. You're guaranteed safety. If you have a professional who really understands safety and is from the first principles, you get my point?
Yes.
Exactly.
Evelyne, then what do we need to do?
First of all, we as employers out there, they should take it upon themselves to train their employees before they bring them into this workplace. They should make sure that they are trained on occupational safety and health standards. Then also they have to go ahead and supervise them, find out whether this person is really healthy. You know, there are some employers, you bring your workers in this workplace, but then you never monitor, are these people really working? Are they really healthy? Is their mental being okay? So we as employers, the employers out there, they should take it upon themselves to always supervise their employees. They should always train them. And then also, they should make sure that maybe like in schools or these institutions, maybe offices, make sure that you're having some kind of maybe gardens. They could be small, whereby these people, after maybe some good hours of work, they can go and have some rest, so they can come back and productively do the work you expect them to do. Okay.
Yes. Nicodemus.
Yes.
What do we need to do, adding on what she has just said?
The doing is, I usually believe in first principles. Very first principles. 1, let's create awareness. 2, let's make it a habit. Just like you brush your teeth every morning, ensure if you come, you ensure the workplace is safe for you. Okay? Once you reach home, supervise the workplace. Before you start that car, please have a 360, walk around. There could be your chick, it could be a baby in there. There could be an animal.
The tires hiding, thinking they're playing.
They're playing, honestly. Before you end your day, check those fridges. There could be a baby in there stuck. Go to the bathroom. See whether the floor is clean, because you want to wake up at night with a bit of, not cautious, and you may sleep, you may trip or slip and fall and bang your head on tires. Let's make this basics safe. You're in the car. If you drive, do you have a first aid kit in the car? And do you know how to use it? Do you have a fire extinguisher in the car? Yes or no? Do you know how to use it? At workplace, how often do you pass by that fire extinguisher even not knowing whether it is expired or not? Basics. Ergonomics, how do you sit? Is the workstation straining your muscles, straining your skeleton, so that we prevent those what they call musculoskeletal disorders? Then also encourage people out there, one of the best investments you can do is buy yourself a high density mattress, because we rarely sit safely, we rarely walk safely, we rarely lift any equipment or any goods in the right way. But let's ensure we sleep safely by buying a high density mattress.
What are your closing remarks? In a minute for this.
In a minute. Thank you so much, dear viewers. I want to just keep this to you members, that we have to make safety practice as a habit. And each of us here has got a role to play. We need to raise a generation that really appreciates, safety and are self-accountable to it. I want to say thank you so much to Makerere School of Public Health, together with Family TV for hosting us, and also ensuring these pertinent issues are well discussed on a weekly basis. Personally, I'm so grateful to be here and share my experience. Thank you so much, and may God bless you.
We thank you as well. Evelyne, your closing remarks as we wind up.
My closing remarks could be that we should take occupational safety and health as a practice. We should take it upon ourselves that this is something that is going to help us today, the other day, and even our grandchildren. Once again, I want to thank the School of Public Health for giving us this opportunity, and also to Family TV for hosting us. Thank you so much.
Thank you so much as well. And to you, our viewer, thank you so much for watching. This is HealthPot, only on Church of Uganda Family TV. We shall come back with more of such conversations and discussions. Just stick it to Church of Uganda Family TV. Edrine, Osteen, Mukalazi is my name. I've worked with Linda Dina, who used to hide in the fridge. Mom was in transmission, and Jonah, the producer. Be blessed.